So robotic surgery, I think the advantage to that is that we can do complex operations through minimally invasive approach. Now we can do it through teeny tiny incisions. We've done laparoscopic surgery for a long time, but laparoscopic surgery is just surgery through teeny tiny incisions. So we can put instruments in through those incisions, and it's an extension of our hands. But the traditional laparoscopic surgery has instruments that are on sticks. And so when you have the tips of the instruments in, you can lever them, you can rotate them, you can open and close jaws on the tips of the instruments. But what you don't have is the ability to bend like you can bend your wrists. And so that's what the robot gives us. It gives us our wrist movements back. So it's basically miniaturizing my hands inside the body. And so now I can do what my hands would have done on a miniature scale, so that the surgery can be accomplished minimally invasively, which means better recovery for the patient, less pain, you're back to work and back to up and running in your normal life faster. You could hook up a camera to this arm, then have a left arm instrument here, and then you have two right arm instruments. And you can interchange what your right hand is doing during the surgery, depending on what you need. It gives me a way better visualization of the tissue, the anatomy, everything is in high definition, and it's three-dimensional, so you get depth perception, which you don't get in traditional laparoscopic surgery. That's the big deal, I think, for patients and their families. You don't have to go far from home to get the same type of care that you would get at a big university setting, for instance. Most of the time, the university settings are fellowship-trained physicians and surgeons that are using the technology that's out there. We have that right here.